There are many reasons that hemochromatosis will increase the risk for heart disease. It creates endothelial dysfunction, which is low nitric oxide. And nitric oxide is something that your body naturally makes. And if you have low nitric oxide, then your blood vessels get more constricted and you don't get good blood flow throughout your whole body. And there's certain environmental things that can increase nitric oxide. So like exercise can increase nitric oxide. High iron will lower nitric oxide, which is one reason it increases the risk for cardiovascular disease and high blood pressure. There are some genes, I go through not just the hemochromatosis genes, but the nitric oxide genes in my genetic detoxification report and in a few of my workshops. So the nitric oxide genes I really cover in great detail in my heart workshop at heartcurse.com. There's some other reasons that hemochromatosis increases the risk for cardiovascular disease. Hemochromatosis, when you have high iron, the iron likes to deposit in your heart and throughout your whole body, but also your heart. And that creates a lot of oxidative stress and damage to your heart. And that will cause your heart to have to work harder. It'll cause your heart rate variability to go down and your resting heart rate to go up. It will increase your risk for plaquing because there's so much oxidative stress in your arteries. So you're more likely to have plaquing, which can create congestive heart failure. You're more likely to get a stroke. You're more likely to get clotting because when you have a lot of iron, there's just more inflammation. And when you have a lot of inflammation, you're more likely to get clotting and plaquing and just in general heart problems. In the Iron Curse, I talk about the heart piece, and I also give specific clinical pearls in the Iron Curse protocols, which should help decrease the heart risk related to hemochromatosis.